Hello again. This is Kingston Town Administrator Keith Hickey with the latest version of This Week in Kingston. With me today is Kingston Fire Chief Mark Douglas. Mark is here to spend a little time with us going over what's going on with the fire department through these past 12 months and some of the challenges they face. So, Chief, welcome.
Thank you, Keith. Nice to see you.
So, what's happened over at the fire department through the COVID situation? How you guys maintained levels of services, and how's COVID impacted what you guys have had to deal with?
So over the past 12 months or so, back to February, late February, early March of last year, we saw the COVID pandemic obviously spread across the country. There was no fire department or EMS service that wasn't affected by it. Locally, I think that everybody certainly watched the news. They saw the extremely fluid situation, the numerous unknowns that existed with how to respond to and treat the virus that was spreading. So locally, we had to implement very quickly an extensive infection control and decontamination program that was really above and beyond what we normally do. We normally will disinfect or decontaminate, if you will, the ambulances and the personnel based on certain criteria of viruses or diseases that were pre-existing that we were aware of. TB would be a good example of that. We would disinfect heavily. What we ended up transitioning to was a process that we did it on every single call. We increased the use of our personal protective equipment, which is gowns, gloves, goggles, all the things that cover us up and prevent us from contracting viruses and diseases. Huge quantities of that we used. Thorough cleaning of the ambulances, equipment and personnel after every call. Daily decontamination and fogging of the stations and vehicles was an interesting addition. We bought a couple of foggers and some decontamination solution from a company down in Attleboro that we got very early in the pandemic, and we would fog the stations and the ambulances every day, and additionally when we thought we needed to. Something very different for firefighters. We live together, or the shifts do, on 24-hour shifts every day, and it's odd to social distance, and that's one of the things we implemented within the stations. These guys are used to being a foot or two from each other on a regular basis, whether it's in the station or on calls. It was very odd for them to have to try to distance themselves from each other, but we did do it, and we had great success with the things they did. Some of the impacts, it extended the call times significantly. We were doing calls that would normally be an hour or so and would go into a 2-hour plus time rotation on the crew and the ambulance. That was primarily due to decontamination procedures. We'd decontaminate the ambulance both at the hospital and when it returned. Then we would have the personnel shower and decontaminate their clothing. So during the pandemic, while the call times went up, the call volume went down a bit. I think everybody saw that nobody wanted to go to the hospital because they were afraid of getting COVID. So that had a couple of interesting impacts. One, we were taking much sicker patients to the hospital. The reluctance to be transported to a medical facility translated into people staying home longer, translated into people getting sicker. And that was an interesting impact that we saw, especially in the early days of the pandemic. People were just simply afraid to go to the hospital, and they would wait until they absolutely needed to. That fact alone extends the call time because you end up with additional treatments and drug usage and so on and so forth. So that was an interesting impact in terms of the public. We did have some difficulty obtaining personal protective equipment through the early days, if you will, of the pandemic. It was in scarce supply, if you will. It was being used in such high volume across the country that it was tough to get sometimes. So we rationed it as best we could and got through it. And towards May, June, July, in that area, it became much more easy to acquire. We did eliminate some things because of the pandemic that we would normally do. We would normally be doing in-person training, fire and EMS training on the shifts. We eliminated that because we didn't have the ability to have outside instructors come in. And probably one of the things that troubled me the most of all of it to eliminate was the fire prevention programs in the schools. The fire prevention programs we do in the schools every year are extremely important, and especially starting at first grade with Stop, Drop, and Roll and some of the other foundational programs that we do with the kids. To eliminate those presents a pretty significant problem because we build on those as we go up through the grades. So that's one of the things as I get down to, what's going on today is we're doing some additional planning, trying to figure out how to catch up on those items that we missed. So we were very fortunate in terms of our employees. None of our employees contracted COVID during the pandemic, and I think we're all pretty proud of that. I think it
Mm-hmm.
to the procedures that we put in place within the department. It speaks to the employees' concerns and attentiveness to their outside lives and their exposures. We did certainly quarantine some people for concerns on a few occasions, but for the entire time up until we were vaccinated, and well, even currently, none of our personnel have actually contracted COVID. And so it certainly speaks to me and says that the decontamination and procedures that we put in place worked. So that is something we're fairly proud of. Um, all the fire department employees now call full time, as well as our admin are vaccinated. So 100% of the department is currently vaccinated. So we've started to back away from the extensive um, in-house mask wearing and so forth, and go back to a little bit more of a normal life within the stations. That said, certainly on calls, we're protecting ourselves as we have throughout the duration of the pandemic. We were able to form some partnerships over the course of the pandemic that have proved to be very valuable to the town employees, us, and the citizens as well. One of those, and it's certainly at the top of my list, and I speak very, very highly of them, is the Skin Esteem Med Spa. We do EMS standbys there and assist them in vaccinations every weekend now up until, I believe they have a date in May when they're going to finish up. To date, they've done about 3,000 vaccinations in conjunction with our folks. They do the EMS standby in case people have reactions, but they also, while they're not treating someone with a reaction, they'll be administering vaccine along with the volunteer nurses that work there. So Matt and Don Naylor have been incredible partners in helping get our community vaccinated. And they've been really incredible partners for the fire department in general. Pro EMS is a company that is based in Cambridge. They run numerous healthcare uh, organizations. One is one that we use every year to do training. Another one is billing. They do our billing for us, our ambulance billing. We partnered with them to do COVID testing for our employees, and we started that about mid-pandemic, if you will. They work with the Broad Institute in Cambridge. The turnaround time is about 24 to 36 hours on a PCR test. They gave us the equipment, the supplies, did the training for our people. So we implemented that. And when needed, we've been able to test our employees. And I apologize, I lost the number. We were well over 100 tests when I last looked. Townwide, during the pandemic, we worked with the emergency management team, which was comprised of everyone from the town administrator, department heads in various areas. We would consult with each other and discuss everything from building closures to safety processes to reopening and vaccinations. In many cases, in the early days of the pandemic, we were meeting once and even twice a day to go over the processes because everything was so fluid. Move on to CARES Act funding. The CARES Act funding for the fire department, I'll speak directly to that, was a great benefit. We purchased an additional ambulance, designated it for use in transporting COVID patients. That took, I hate to say the heat, but that took a little bit of the heat off the other two trucks. We were able to put these in rotation and clean them thoroughly so that each call, hopefully, depending on the volume, but each call was getting a very clean truck that we did not have to have concerns about transmitting the disease with, either to our employees, of course, or the patient. So that truck has several features, including high capacity HVAC, heat, ventilation, and air conditioning systems that allow it to be perfect for COVID responses. We purchased necessary equipment, implemented a community EMS program that allows us to bring medical and safety related outreach to residents in their homes and allows the EMTs and paramedics to go out and vaccinate the public in conjunction with a clinic or a local board of health. Jump fast forward, we're going to do believe it's 28 homebounds this coming week with what we believe will be the Johnson & Johnson vaccine in using that program. So we were able to get licensed during the pandemic, get that project done, and we'll be able to go out and do some homebound vaccinations this upcoming week or two, maybe another week out. So that's a fantastic accomplishment relative to community outreach. We purchased a medical training simulator. Each year, we would normally send our firefighters, paramedics, EMTs to school. They go to a sim lab every year to practice skills that would not normally be frequent. Pediatric resuscitation, or frequently done. Pediatric resuscitation would be an example of that. And those will be done at Pro EMS in Cambridge. That wasn't able to be done this year, so the CARES Act allowed us to purchase a mannequin, actually two of them, that are computerized and simulate all of those things that we would normally be doing at Pro, and we were able to do that in-house. So we were able to maintain the skill levels that we take pride in every year, and do that in-house without having to travel. So fast forward again, that will allow us to do a great deal of that from now on in-house, and that was a great benefit to the CARES Act money. CARES Act money also allowed us to fund a large quantity of the supplies we needed to deal with COVID, the EMS supplies, whether it was gowns, gloves, whatever was necessary. It also provided funding for overtime for COVID-related responses, whether we were covering a shift because we have people on quarantine or whatever that requirement was, vaccinations. That money has been very, very helpful and put to good use, certainly by this department. So that's kind of the wrap up on COVID. We're certainly dealing with the vaccinations now. We're going to adhere to the CDC guidelines as they hopefully slowly back away from the rigid approach as COVID starts to go away, we hope, in the next few months, and get back to what we hope, as many do, is our normal kind of daily lives. So what's going on currently here in terms of planning for that new daily life? We're working to catch up on many of the things that we weren't able to do because of COVID restraints. And training is one of the primary areas that we need to focus on. Each year, or each 4 to 5 years, I should say, the Insurance Service Office comes in and rates a fire department based on their training, the ability to supply water, fire attack, and many, many, many other areas. And then they classify you in a category, a class 1, 2, 3, 4, 5, 6, etc. Currently, we're a class 4, excuse me, we moved down. We're class 4, which is good. We're trying to, pre-pandemic, we were trying to get down to a class 2, as many departments have been able to. So we have to resume some training and accomplish some other things in order to get down into that category. So that's super important to us. Planning to resume fire prevention in the schools, that's going to be a difficult challenge. The schools themselves, in conversation with them, have got a tremendous amount of catch up to do themselves. So we're going to have to work diligently with them to integrate our programs into theirs where we can get the time to do so, and try to get especially the lower school folks back on track. The first graders are the ones that concern us the most because they get into the program obviously in first grade, and they get stop, drop, and roll, and all of the things that are really the foundation of what we build on through the 6th grade. So that is a big star, priority 1 on our planning list. With protective clothing sizing and purchasing, we weren't able to do any of that, and we have to get some gear replacement done. Cleaning, they've got cleaning going on today, extracting the carcinogens from our gear, which is done once a year by a professional third-party company. They also evaluate the gear for damage. Maintenance and testing the equipment apparatus in conjunction with our outside vendors. Every year, NFPA requires that the apparatus and the rest of our equipment be tested and maintained. Because we are a small department, we're not able to do all of that ourselves. For example, pump and aerial testing has to be done by a third-party vendor. And because of the personal contact that is required, most of that was put off. So we're trying to jam a lot of that into a very short window in the next couple of months. Working on some building maintenance. That's getting done on a regular basis now. So we've had some, whether it's floors, carpentry, whatever it needs, excuse me, we're getting those folks in to get that done. We've resumed construction on the landing zone for the medical helicopters at the Pembroke Street Station. Eversource was kind enough to allow us to use some land so that we'll have a dedicated landing zone for MedFlight at the Pembroke Street Fire Station, an area that we can maintain without having concerns about flying soccer nets and some of the other stuff that comes with using athletic fields. The new tower ladder that was approved at the fall town meeting is on order. We're able to do all of the pre-construction conferencing virtually. That will be scheduled for December of this coming year. And actually, when we talk about these shows, that will be a great, the construction process for that truck, I think, will be a great couple of shows. We'll be able to go out to the factory and walk around the truck, as many departments have, and video the construction process. So that may be something interesting for us for the future. The cardiac monitors that were funded at the fall town meeting are also in service now. Those are working really well. The new technology in those, the way we record and transmit the patient information electronically is working out really, really well. And lastly, we donated the old monitors to the Silver Lake Regional High School so that they can use them as simulators for their medical education program. So that's kind of a summary of COVID and what's going on currently. And I probably just skimmed across the top or hit the high points, but that's kind of, yeah, now.
Sounds like you've been very, very busy.
Yeah, it's been a busy few months, that's for sure.
It certainly does take, it certainly says a lot about the fire department and the staff you have there to be so protective and concerned about COVID, not to have anybody have to or have gotten the COVID, have gotten COVID themselves. So that's great.
Yeah, it's tough to not give the employees credit for that.
No
There's
question.
certainly a little bit of luck involved, right? I mean, there was enough COVID out there that it would have been pretty easy to get. But when you have 25 people that paid that close of attention to their outside lives as well as the lives they have here at the fire department, I think that really speaks for their professionalism, frankly.
No question about it. It's great. You guys have done a tremendous job providing services and first response to everybody who's needed in Kingston. And I really want to thank you guys very, very much for everything you do for this community.
Thank you. I appreciate that.
All right, Chief. Thanks for coming on. I appreciate it very much.
Thanks. Take care, Keith.
All right. Bye-bye. Just a couple of quick other things to mention. The Council on Aging is going to be opening up the Senior Center building on a limited basis on Monday, May 3rd. They're going to be having a grand reopening from the 4th to the 6th between the hours of 10 a.m. and 2 p.m. Guests will have an opportunity to look at the existing safety protocols that have been put in place. Group programs will begin the week of May 10th, and masks will continue to be mandatory there. So anybody who's interested in going back to the Senior Center and taking advantage of the opportunities they have there, we urge you to do that. Something very, very important coming up. Obviously, the elections are going to be held, town elections on Saturday, April 24th. If you would like to vote, we urge you to do so between the hours of 8 a.m. and 6 p.m. at the Kingston Elementary School at 150 Main Street in Kingston. One important date people need to be aware of. If you have not registered to vote yet, you have until Tuesday, April 6th. You can also register online if you'd like at http://vote.gov/register/MA. So that information is on the town website if you'd like to take a look, or you can always obviously come into the town clerk's office and register in person as well. But that deadline is coming quickly. So anybody who is not a registered voter in Kingston, please take the time to do that either in person or online. So you have the opportunity to vote for all of the officers who are running for public office in April. So with that, I want to thank everybody very, very much for watching, and we'll see you next week.